The coroner's report reveals Williams suffered from a disease called Lewy body dementia. It also shows there was no alcohol or illegal drugs in his system. Lewy body dementia is a terrible disease that few have heard of, but an estimated 1.3 million people suffer from it. Sanjay Gupta is our chief medical correspondent. And I mean, Sanjay, it's pretty incredible when you look at those numbers, when you're talking about 1.3 million people. What is it? What are the symptoms of it?
Well, you know, it's something that you only can conclusively know after someone has already passed away. But you get a pretty good idea. Neurologists look for specific things. When you talk about dementia, it's loss of memory, it's loss of ability to be able to do things that you normally were able to do. But Lewy body dementia, as you have up here, has some more cardinal symptoms here, hallucinations being one of them. Doesn't mean everybody has hallucinations by any means, but that's something that could develop. Movement problems, that's a big one, Aaron, because you remember we talked about the fact that he had Parkinson's-like symptoms. That can actually also be caused by Lewy body dementia, this brain disorder. And then obviously the problems with memory and confusion. Those can be more things like Alzheimer's type disease, but this is pretty characteristic for this particular
issue. For what he would have had. All right, so now I just want to show for everyone, this is a normal brain and a brain with Lewy body dementia. So tell me what we're looking at.
You're looking at a very fine cut of the frontal lobe of the brain, a very particular part of the brain. Over here, this is normal. These are just normal neurons. You see the way the brain should normally look. This is the exact same part of the brain over here, but with a specific stain over here. That's staining for something right here, that brown clump. That is a Lewy body. That's what they're specifically talking about. If they see that, then that sort of makes the case.
So is it like a plaque, like in Alzheimer's or something that we're talking about, or is it?
Very similar to that. It's basically these clumps of proteins. So think about the fact that your brain is sort of functioning over here. Signals are transmitting back and forth pretty normally. But over here, you see all this brown stuff, not just the big body over here, but just it sort of feels...
These little squiggly things are also
that's all part of
body.
It, and it sort of just mucks up the ability for the brain to transmit signals more normally, and that's part of the problem here.